The agricultural and industrial revolutions that began in the 19th century brought advances in many industries, including large-scale agriculture, food production, and transportation. Over time, food supply increased and famine became less of a problem. However, along with benefits came some health concerns. One of those continues to pain people today: diverticulitis. Diverticulitis is often considered a mismatched disease of the Industrial Revolution. As food processing became more centralized, the condition became much more prevalent. For decades, it was diagnosed more often in seniors. However, in the past 20 years, it has become much more prevalent in people ages 50 and under. Among younger adults, the complications are more urgent, but the treatment and recovery time is better. It can be treated, some of which may involve hospitalization or surgery. Recommendations continue to update as doctors know more. However, patients are often overwhelmed with these decisions while they're feeling quite miserable. I'm Wanda Frazier. This is Your Body and You. Data. There is currently no centralized agency that collects all data for diverticulitis. Data from the NIH has not been updated since 2021. What we do know comes from population estimates based on hospital and outpatient records, including autopsies and imaging data, community data from homogeneous groups, and literature reviews. As of 2025, annual estimates for diverticulitis in the United States were about 180 per 100,000 people. It was estimated that 200,000 people would be hospitalized. The majority of cases occur in Americans over 50 years old. However, over the past 20 years, hospitalizations for diverticulitis have been rising in patients under 50, considered early onset. The latest large-scale data set I've seen ended in 2020. About 16% were early onset cases. Of those, hospitalizations increased from 18.5% to 28.2%. Over a 21-year span, there were about 114,000 deaths. In order to define diverticulitis, I'm going to talk about the anatomy and physiology of the colon first. The colon reabsorbs water and electrolytes back into the body. The colon does not produce digestive enzymes of its own. Any digestion is processed by gut bacteria. These gut bacteria also produce vitamins that are absorbed back into the body. Quadrants. Physicians identify quadrants of the abdomen where organs are situated so they can better understand symptoms and causes of disease. The colon makes up the majority of the large intestine. I'm going to talk about the sections of the colon in relation to the quadrants they occupy. Chyme. Chyme is indigestible food material from the small intestine. It enters the large intestine. It travels up the ascending colon and the right lower quadrant. Then it crosses above the small intestine in the transverse colon from the right upper quadrant to the left upper quadrant. Then it travels down the descending and the sigmoid colon and the left lower quadrant. Then it enters the rectum to leave the body. There are two types of motility in the colon: haustral contraction. Haustra are the saccules or segments of the colon. This motility slowly moves chyme from one haustra to the next. As one haustra distends, the muscles surrounding it are triggered to contract and move the chyme along to the next. It takes about 25 minutes. This helps the body absorb water and electrolytes. Mass movement. Mass movement is the stronger motility toward the rectum. This is triggered by food entering the stomach. It occurs maybe 3 to 4 times a day. The colon in cross-section. The colon wall is made up of several layers. Starting from the inside is the mucosa layer. This layer consists of epithelium, connective tissue, and a thin layer of muscle. Then the submucosa. This layer consists of connective tissue, blood, and lymph vessels. Then the muscularis propria. This layer consists of an inner circular muscle layer and an outer longitudinal muscle layer. Then the outer serosa. This layer consists of epithelial cells. The colon is designed for all of the section and layers to stay in this structure, so the colon can perform its functions smoothly. When the structure changes, chyme cannot flow through properly, which causes diverticular diseases. Diverticulosis. The muscularis layers of the colon can become weak with pressure and straining. The mucosa and submucosa of the colon can herniate through the muscularis layer, creating diverticula, or small bulging pouches. Diverticula refers to the diversion of the chyme into these pouches. Usually this condition occurs in the sigmoid colon in the lower left quadrant, perhaps because the chyme is more concentrated. Most people never develop symptoms of a diverticulosis. It often presents as an incidental finding on a colonoscopy. Some people experience bloating, constipation, or abdominal cramps. To relieve these symptoms, doctors recommend high fiber, increased hydration, and exercise to move the chyme along. This condition is quite common in the United States. More than 30% in adults 50 to 59 years old, more than 70% in adults over 80. However, from 5 to 25% of people with diverticulosis will develop diverticulitis. ITIS refers to the inflammation, usually in the lower left quadrant. There are two main categories. Uncomplicated diverticulitis, UC, presents as local inflammation, pain, and fever. It can be managed with a liquid diet and some outpatient care. Complicated diverticulitis, CD, presents with more severe complications, such as phlegmons, abscesses, perforations, obstruction, or fistulas. Stages 1 and 2 are more localized and treatable with antibiotics and a liquid diet. These can reoccur, but doctors manage this with recommendations for more fiber, fluids, and exercise. Surgery is not generally recommended. Stages 3 and 4 are more severe. In stage 3, the abscesses or fistulas have ruptured, releasing pus into the free peritoneal cavity. These are emergencies. They require emergency surgery and may be fatal. In stage 4, the abscesses or fistulas have perforated freely, releasing fecal matter into the abdominal cavity. These require immediate life-saving emergency surgery. Surgeries involve resections or colostomies to remove the affected area and close up the perforation. Colostomies connect the colon to the outside of the abdomen. For patients who survive, these surgeries can last a few hours. A patient can stay in the hospital for a week or 2. Full recovery takes a couple of months. After a full recovery, doctors generally recommend more fiber, more water, and more exercise. Even nuts, seeds, and fruit can be beneficial. Mortality rates for diverticulitis range from 0.5% for less complicated cases to 10% for advanced or more complex cases. Diagnostics. Diverticulitis is diagnosed from a combination of physical exams, blood and urine tests to check for infections with a high white blood cell count, and imaging. A computed tomography or CT scan shows inflammation, abscesses, or perforations. A colonoscopy done after the patient recovers can help rule out additional problems in the colon. Risk factors and prevention. Risk factors and prevention relate, so I'm going to talk about those together. There are risk factors for diverticulitis that cannot be changed, such as age and genetic predisposition. With the increased risk in younger adult populations, researchers are looking at risk factors that may have been or can be changed. One of those is fiber consumption. At various times in human history, we forgot the importance of dietary fiber. Food processing since the beginning of agricultural and industrial revolutions removed much of the fiber from crops during processing. Now we eat sugar without the fiber that our human metabolism needs. Currently, the majority of Americans do not intake recommended amounts of fiber. Dietary fiber keeps chyme flowing smoothly through the digestive system and feeds the gut bacteria that benefits us. There are other risk factors for diverticulitis. Obesity is a major risk factor for diverticulitis. Obesity has been trending up in younger populations. This graph shows the increase in obesity rates between a 10-year period in different age groups. Certain medications increase the risk for diverticulitis, such as steroids, opioids, and NSAIDs. We know that the United States has struggled with an opioid crisis for the past 20 years. Smoking is another major risk factor. The smoking rates have been trending down in younger adult populations. Keep in mind that during the agricultural and industrial revolutions, we did not know a lot of this information. Now that we know more, we can do more. So stay diligent, talk with your healthcare team about any risks, and ask for suggestions. Check on your people. Please like, subscribe, and share this video. Comment something useful because none of us have time for nonsense right now. Stay safe. I'm Wanda Frazier. This is Your Body and You.